Today we're talking about MCAT Foundational Concept 9A, and our specific topic for today is identity. Now, understanding identity is not just important because now the MCAT is testing you on psychological and social concepts, but this idea of the self, of how we view ourselves, what our perception of ourselves is in a larger society, this is kind of a central concept in introductory psychology. So let's talk about what identity is. Now, if you'll think back to your freshman year of college, maybe when you moved into your dorm for the first time or you joined a club, you had to do these icebreaker activities. And everybody sat around in a circle, and you may have said your name and what your intended major was, and you may have mentioned what your hometown was, maybe where you traveled. But what you effectively did was to create a multi-dimensional picture of yourself, effectively what your identity was within that group. Now, the idea of identity is not just how we're going to present ourselves to others and what characteristics we want them to see about us, but our identity helps us to define what is normal and acceptable. Not just for us and for our behavior, but what we're going to think is normal and acceptable in the society that we live in. So let's talk about what forms our idea of identity. Now, according to traditional Western thinking in sociology, we tend to think of our identity as being our perception of the world. Essentially, it's us looking out on the world around us. Now, if you've taken an introductory psychology course, and even if you haven't, you might have heard of Erikson. Now, Erikson is considered to be the father of modern personality theory, of identity theory, and according to Erikson, our identity is not just formed based on the way that we look at the world, but our identity is also formed by external circumstances, the way that the world affects us. And this can be things like our geographical location, where we live, changing social things around us, whether or not we're living with our family, our spouse, things like where we go to school, what career that we choose. But basically, Erikson is saying that there's this constant struggle back and forth between the way that we are viewing the world and the way that the world is influencing us. Now, according to Erikson, there are 8 psychosocial stages that we go through in life. Now, Erikson breaks these stages up based on age. But as you can see, they're based mainly on psychosocial crises that we encounter throughout our life. Now, this isn't meant to sound scary, but what Erikson is trying to bring across is that there's this constant struggle that we have. From the moment we're born, we're faced with issues that are based upon our views of ourselves and how we fit into the society around us. It starts with things as simple as trust versus mistrust. As a baby, are we going to trust our parents, our family, our care providers to meet our basic needs, to make sure that we survive? And this is our reconciling how we feel inside with how the society or the group of people around us is treating us. Now, we're not going to go through all of these, but we are going to talk about one that's important for what we're dealing with today. And that is Erikson's stage of identity versus role confusion. Now, according to Erikson, this occurs at ages 13 to 19, and that's typically when we're going through the transition from child to adult, when we're experiencing adolescent changes. And this isn't just based on biological changes like physical growth or secondary sexual characteristics, but during our adolescence is really when we determine who we are, what kind of friendships we want. It's when we determine what our sexual identity is going to be. We make decisions about career, about schooling, where we want to go to school, whether or not we want to go to graduate school afterwards. There are a lot of important decisions made during this specific time period that help to develop our permanent sense of identity. Now, we talked about identity in the sense of being a college freshman and characteristics about yourself that help you to form an identity, but let's talk about identity according to the biopsychosocial model. Now, according to this model, there are three different components that make up our identity: our psychological identity, our biological identity, and our social identity. Now, some of the psychological factors that play into our personality or our identity are things such as our actual personality. Are we very outgoing? Are we shy? Do we view ourselves as being very masculine, feminine? How do we view ourselves in terms of what our sexual identity is? And all of these things work together to form a picture of what our psychological identity is. Now, when it comes to our biological identity, these are often things that are race, our physical appearance, our ethnicity. These are immutable parts of our being. And I guess they're not always totally immutable if you have plastic surgery to change your appearance, but in general, our biological factors are unchanging. Now, as far as social contributors to our identity, this includes things like our family and our friends, our religion, how we identify ourselves in that way and the people that we identify with. And this can even include things like social class. And this doesn't necessarily need to be financially based, especially if you're still within the 13 to 19 age group. This can be the group of people that you surround yourself with and whether or not you associate with the popular crowd or the nerdy crowd or the pre-med crowd or whatever your social class is and how you view yourself and what group you fit in with. Now, I don't need to tell you this, you can probably tell just by looking at these different characteristics, but all of these various components of identity are interconnected. So let's take physical appearance, for example. Both our race and our sexual identity play into what our physical appearance is going to be. Often our ethnicity is tied to our religion. Our family and our friends are often determined based on our social class. Our personality influences the type of friends that we have. And so we said before, when we were talking about the example of being a college freshman, that personality and identity was multidimensional. But it's important to understand that in addition to being multidimensional, identity features are also interconnected. Now, why do you want to know about this for your MCAT, or why do you care? Why is this important? Well, being around like people does strengthen our concept of self-identity. But in addition to this, we continue to have this fascination with people that aren't necessarily like us, that don't have the same types of behavior or components of identity. Now, we absolutely need classifications and social systems to help us create this society around us. But by nature of having a society that's diverse and that is full of people that may not have the same characteristics, there are people that are going to feel excluded and that are going to suffer disproportionate changes with power and money disparities. And so it's important to understand how people feel about themselves and how their identity affects them. As a physician, you might have people say to you, I'm not the kind of person who likes to exercise, or I'm not the kind of person who likes to take drugs. So you need to understand how the person is viewing themselves and how you as the provider can meet them and view them in the same way.